So this is the week 10 Kahoots. That is the 59 question one that again goes over the concepts. Concepts are in many different ways. We might see it. Let me pull it up. And there you are. So what I highly suggest that you do for this, Essie, number one, make sure you listen to my Q&A. It's very important if you can't come. There is always your NCLEX, your Saunders NCLEX book with all pediatrics, those HESI hints. I see them coming up also. And of course, go back and test yourself with those 100-question Kahoots and see if you are understanding them. Well, let's just get going. We're doing good. We should be about an hour, and then we'll be done for today. A toddler swallows grandma's digoxin. What should you anticipate? Doctor going to order for this? Bringing you back to a little pharmacology here, right? But this is a reality. Students do this. Children loved anything pills, they stick it in their mouth. So remember, digoxin is dangerous. It lowers the heart rate and it can be toxic. Remember, young kids can't tell you that they don't feel good or they're nauseous or see yellow spots, right? But we could do a level, and depending on how many pills, we're going to get that digivine immune fab, whatever you want to call it. Isolate. Signs of respiratory distress in children. And this actually question is specific to your infant. Small infants have a couple things that they do that they're in trouble and you need to do something now, or they're going to code on you. And that's the flaring nostril with the grunt at the end of every breath. That restlessness. Yes, it'd be tachycardia initially. The end stage of respiratory, that late sign is actually bradycardia, but the initial, they're tachycardic. When a pediatric patient has an amputation, what priority teaching is very important. This could be that osteosarcoma, right? Could be the crush injury. So everything you do for an adult, you'll do for the children here. Again, it's making sure the amputation doesn't have breakdown. Many of them are on the legs, making sure the prosthesis hasn't caused any rubbings, because if you get a big infection breakdown, you're not going to be ambulatory, right? You're not going to be able to get around is what you want to be. So multi. What is acute uh, myelolytic leukemia in children, and what are the symptoms? Myelocytic. Can't say that word for some reason. AML. What symptoms do you see? ALL, AML, it's just a different white blood cell that it attacks. They're both the same symptoms, and it's the same in adults, same as children. You're going to see the cancer eating not only white cells, but also the red blood cells. So they're anemic. They got bone and joint pains. They have no, infection anything to fight. There's no immune system. So they're going to have frequent infections and then that bruising. Their platelets are also low, causing the bruising. Multi. What are the signs and symptoms of pyloric stenosis? Remember, with pyloric stenosis preoperatively, this child will be NPO and an IV is started. They do not need antibiotics. That's the difference between the TE fistula and pyloric stenosis. You're not concerned this one on aspiration, like the TE fistula or esophageal atresia, okay? Those were two exam questions today. Pyloric stenosis, projectile vomiting, put your hand underneath their xiphoid process in that right upper middle. You're going to feel that olive or the marble, as I call it. And what do? Tell them to be NPO, to get their ultrasound, start an IV to give them their sugar and fluid, and get them to the OR. That's the treatment. A multi. What may be a problem seen after surgery for tetralogy of Fallot? Well, tetralogy of Fallot is the pulmonary artery, which is kinks off or closes and doesn't allow blood to go into the lungs. What can happen with that? And remember, those are TET spells. Well, because their right side could be stretched out, because they're not getting oxygen, you're going to see things like fatigue, poor appetite, respiratory distress, and tachycardia. The heart's trying harder to get oxygen around. A multi. What are defects associated with the tetralogy of Fallot? There's four different ones. Remember, tetralogy is all right-sided. So when you look at this, what are right sides? Is everything except aortic stenosis. The aortic valve is from the left ventricle to the body. That's left-sided, okay? So the rest are right-sided. Would cause an infant to have nasal flaring. And that is respiratory distress, absolutely. When you see that flaring, I wait for that grunt and I'm like, doctor, we need some help here. They'll go down pretty quickly there. An 18-year-old parent wants the lab result of their child. 18-year-old's alert, aware, normal, quote, 18-year-old. What are you going to tell that parent? You will always see one of these consent issue problems on a HESI, always, on NCLEX, always. Again, an 18-year-old signs for themselves. You need to ask the 18-year-old, can I give this lab result to your parents? Now, most parents will be there with a bat behind them saying, you will give me those results, but you do need permission from them. What is synergist and why is it given? Synergist. And it's the RSV vaccine. Remember, it is monthly, only the first year of life, and usually from winter to early spring. So it's not the whole year, but part of it. Why do we give it? All your immunosuppressed children, premature children, born with lung problems, cardiac children, all of those children, you don't want extra stress on breathing, right? And RSV puts mucus in the airway and a low-grade fever. So it's hard to suck, swallow, and breathe. So we prevent it by giving Synagis monthly. What is the highest priority with a preoperative infant with bladder exstrophy? What is bladder exstrophy? It's when the bladder is born on the outside of the body. Now, it still works, still connected. You'll still urinate through your urethra into the diaper. But what's our big concern? And would that matter if it was anything born on the outside of the body? It's all about risk for infection. Also, keeping skin integrity, right? Making sure that there is no breakdowns. And it's always number one, infection. Cover it with a sterile, moist, normal saline gauze until the urologist, neurosurgeon can come in there, right? That's our concern. A 10-year-old wants an insulin pump for type 1 diabetes. Is this okay? Do they get it? I mean, what's our concerns about an insulin pump? Just putting insulin directly into the body, right? It's a great option for a 10-year-old, especially you need a child who's alert, cognitively aware, that knows how to test their blood sugars, know how to bolus it, work the machine. It is a great alternative. They put one needle into their abdomen and they put a gauze, cover it with a dressing, and it can stay in there. I had one student tell me she was type 1 diabetic and she'd leave it in for almost 2 weeks. Now, I don't think that's appropriate, but I'm sure there's some sort of guideline, but only one stick instead of 4 or 5 a day. It really makes a difference on those children. A multi. When and why would a Lyme test be done on a child? Well, what's a Lyme test? So a Lyme test is caused from a tick bite. And we know that they check for this Borrelia burgdorferi, which is showing you that it was a bite by a Lyme or that tick there. And you can't get a test done. It's not going to show up until about 1 to 2 weeks after exposure. You might see the red wheels and stuff going on, which might be the clue to it. I've seen children go on for a long time and then have cardiac issues, etc., because it lasted. They didn't, diagnose it. It's sometimes hard to diagnose. What might you see after administering a bolus of albumin to a child? So we're giving this protein, this albumin to a child. Usually we do it when they have a lot of interstitial edema. They're swollen and you want to get rid of all this extra fluid. So increase the protein, it sucks out the fluid, and you're going to see an increase in urinary output. So it's going to decrease peripheral edema and it's going to increase the urinary output. It works actually very well. A multi. What is another term for erythema infectiosum? This is one of the viral diseases. We don't necessarily cover it. It's actually, the integumentary system. This is one of those little viral things that kids get. It's also called slap cheek syndrome. And it's also called fifth disease. It's not a bacteria, it is a virus, it is contagious, and usually those kids have those big red cheeks on them. And the other name is fifth disease. I've seen this question in the HESI before. What is the treatment for pertussis? Oh, pertussis if you didn't get the immunization, right? Remember, pertussis is all airborne. It requires these children be placed in those reverse airflow. You with one of those masks on to protect yourself, and it is bacterial. It's Zithromax. So Zithromax and that reverse flow room. That's how we treat it. Hopefully, we don't see it, but I've seen it before. How do you get rid of cradle cap on an infant? That white crusty stuff at birth? It's one of the questions you'll hear from mothers on little baby girls when they want to put bows in their hair and their head is full of this white crusty stuff and they're like, but I want more her head pretty. So what you do, there's a couple different things. You wash it normally with soap and water, right? But they say put mineral oil, some lubricant on it, and then a fine tooth comb. Now it's not going to come off in one time. Might take a week, but slowly you're getting rid of that white crusts that are there. Postoperative abdominal surgery child has an elevated heart and respiratory rate. What assessment might you make? Why would a post-op child with abdominal surgery have an elevated heart and respiratory rate? That's the answer to that question. The kid is in pain, absolutely. And sometimes even when they're intubated, even paralyzed, they still can have pain. And you're going to see the elevation of the heart rate, respiratory rate. Not uncommon on that either. One of those little clues, something's not right here. That heart rate's gone up, respiratory rate's up. And of course, you would give them an extra dose of pain medicine. What can cause rheumatic fever? And that's your strep throat. Remember with rheumatic fever, there's the joints, there's that chorea movement, there's that rash going on, and that sore throat, all that things. But remember, they get a heart valve damage. If it's damaged, it will not come back. But if we can catch it before that, all the other symptoms can be turned around. Long-term antibiotics, maybe a month's worth, and it will go away. An adolescent girl wants information regarding birth control. What does the nurse do? An adolescent wants to know about birth control. Do you give it to her? Don't you give it to her? And again, this is something about the rights of an adolescent and her body. And what they say is you need to give her written and oral information, not your opinion. That's the big thing. Only facts. So written and oral information, and then they can make up their own mind about it. Okay. It's not me saying, no, you shouldn't be doing that. It's not for me to say. Giving her the information is what I do. A multi. How can you control GERD in an infant? Gastroesophageal reflux disease. And that's about burping frequently, not overfeeding them. And it's thickening that with just, they take 1 teaspoon per 1 ounce of whether breast milk or formula, and that thickens the formula. 1 teaspoon is all it takes, and it holds that food down. And of course, the elevated of the head 30 minutes to an hour afterwards. Now, how do you know if the GERD is better? By just adding cereal. As simple as you're going to see less spit up, less vomiting. That's as easy it is. Less vomiting. So what is Synagist? Yep, it's your RSV vaccine. Good. A multi-select. A 15-month-old brings a spoon upside down to their mouth, and the mother asks, is this normal? So the 15-month-old is eating, and the spoon is upside down, backwards, whatever, wrong way. Is that normal? Well, you need to find out why is she concerned. You know, it because maybe she saw somebody else's child or her younger child, something, because we want to alleviate that stress. This is absolutely normal. They're experimenting with it. Front side, back side, doesn't matter as long as they're trying to feed themselves. It's just part of it. That's all of that magical thinking, isn't it? A multi. How is juvenile idiopathic arthritis treated? JIA. Oh, excuse me. Remember, JIA is all about keeping those joints flexible and exercising in a way that keeps them moving. It is NSAIDs for pain. They are placed on methotrexate, maybe some sort of biologic like Humira, and steroids are for when they're in very bad, painful flares. A toddler's vomited 2 times, is listless, and irritable. What do you tell the mother on the phone? So I guess the mother's calling in to the doctor's office. I, they vomited 2 times, but they're listless and irritable. What am I going to do? This is the one, if they're listless and irritable, it doesn't take 10 times of vomiting to be dehydrated. I've seen one huge vomit on a younger infant where they were dehydrated already. So don't think that it's the amount. 2 times could put them dehydrated. That listless, irritable is telling you something's going on. Fluid's not getting to the brain because they're dehydrated. Take them to the ER now. Get IV fluids. An adolescent status post amputation for osteosarcoma is angry and they're blaming the parents. Why is he doing that? It's absolutely normal. First thing, remember, it's the grieving process. They've lost their part of their leg. They are going through that grieving. And the first part is being angry and blaming. Another multi. What should the nurse assess with children with hypo and hyperpituitaryism? Well, go back to the pituitary gland. What does it do? There's two lobes. There is a growth side and there's a fluid side. Which one is this addressing? It's all about height and weight, right? If they're not getting enough anterior pituitary, it's that growth. They're not growing the way they should. You're going to see it as evidenced by decreased height, decreased weight. And that's why we weigh our children every visit, all ages. A multi. An infant with a TE fistula, what should the nurse have at the bedside? So a tracheoesophageal fistula. It's a hole connecting the esophagus to the trachea. What are we concerned about? So this child will not be fed by mouth, either through an NG tube or anything, because the chances of aspiration. So we want to keep even the mucus as decreased as we can. So suction and keep the head of the bed elevated on them. These children end up will get it repaired. Sometimes, if they can't do it right away, they'll put in a gastrostomy tube for that meantime, and they'll do a fundoplication to prevent those aspirations. A child's been having diarrhea for 3 days. What should the nurse check? Like, what are you checking for? What do you think? Diarrhea, 3 days. 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 We're going to check the heart rate. We're looking for dehydration. Respiratory rate's not going to tell us that hydration status. Abdominal circumference, unless you say with abdominal pain, and fever is not with diarrhea. So yes, heart rate. Then we're going to be looking at, of course, blood pressure, capillary refill, urinary output, all the other dehydration. Multi. What is a VP shunt used for? We have it there to drain the extra fluid off the brain and put it into the peritoneal cavity. And it's because there's all this fluid and it can't drain normally. So these children will have a VP shunt in for life. And it keeps that pressure off the brain so the brain doesn't get squished with the extra fluid there. What would you see with a child with autism? Autistic children are going to be doing those repetitive behaviors, playing alone in the corner. They do not come when you call them. They don't like loud noises. They don't like bright lights. They don't like crowds. And these are all those things with autism or artistic behaviors. Sometimes it's that repetitive behavior that starts you with a clue if that could be something like that. A multi. A mother of a child diagnosed with Duchenne muscular dystrophy wants more children. What do you know about Duchenne muscular dystrophy? And what do you know about the mother with Duchenne? Remember, it occurs in children. We usually find it ages about 3 to 7, usually males. And it comes from mom. It's that X-linked recessive. Usually every male born with this mother is going to have Duchenne muscular dystrophy. So what would you tell that mother? Recommend genetic testing to see where it has come from so they know the chances and possibility before they try to have another child. Another multi. An umbilical hernia has become hard and painful. What should you tell the parent to do when called? So the parents called you at the doctor's office. That little belly button umbilical hernia is getting really hard. The baby's crying. What am I going to do? What we're going to do is, yes, absolutely make that child NPO. That kid's going to the OR, probably a strangulated, incarcerated hernia. Something's going on that we need to protect that bowel. So they need to go to the pediatric ER so they can get a pediatric surgeon and take them up to the OR as soon as we can. Very good. When should solid foods be introduced to an infant? So it's about 6 months, right? And we do one food at a time, 4 to 7 days in between that reintroduction. And they say rice cereal is the least allergenic. It should be introduced first. What acid base imbalance is caused by hyperventilating? Again, this was a question pulled from a HESI. The students were like, what is it? I don't know. And it is respiratory alkalosis, hyperventilating. There was one HESI I saw 4 acid-based questions. So I highly recommend that you look at the diarrhea, the vomiting, and the respiratory. You're going to be seeing them. It is part of my HESI Q&A that I do. I review it again. Multi-select. The child's fallen and a stick has scratched their eye. What should you tell the mother to do? Again, she's called in the doctor's office. My kid's fallen and it's scratched. What should I do? Do I come there? What do I need to do? So, I mean, if they have a Fox shield, it'd be good. It's a hardened shield that just covers it to prevent anything from pushing there. Never ever take out anything that's stuck in there. If it's floating, I wouldn't even tell a parent to do that. I would send them to that either pediatric ophthalmologist or send them to the emergency room and let them work with it so that we don't lose this child's vision for life out of that eye. So the key word here was a Fox shield, and that was a question again that my students tell me about. An infant's congested, febrile, capillary refill is less than 2. What should the nurse do? So that all the other stuff was more of this distractor here. The infant's congested and febrile. That is going to be a child who's going to be isolated till we figure out, is it a viral infection or is it a pneumonia? Is it a clean patient or one that requires to be by themselves? So yes, just keep them isolated. It's just room assignment. A school-age child has reoccurring dermatitis, eczema. What suggestion would a school nurse provide the parents? So they're constantly breaking out with all of this itchy rash, eczema. So when this child's having flares, that means they are usually they've itched so much that they're oozy and they're juicy. This is when they can get infections. So keep them home during those areas. Of course, this allergenic and homeschooling, no. Wear gloves, no. When they are at that point, keep them home and then they can come back. I don't know if hypoallergenic lunches, will really help. I mean, maybe some foods causing allergies, but not what that one says. A multi. Why do you give aspirin to a child with Kawasaki? What is Kawasaki disease? A multi-system vascularitis. Vessels get inflamed. And we're worried about mostly here is your coronary arteries. So it prevents clots with all these micro little inflamed little clots being burst off. It is that anti-inflammatory, which is decreasing that inflammation of those vessels. And the thinning blood is to keep it going through those coronary arteries so that we keep the blood pumping and we keep the heart, healthy. We also give IVIG, right? Newborn child has suspected congestive heart failure. What confirms this? Newborn. So congestive heart failure, you have a newborn child, they're going to have their hands and feet are always come out dusky, always, even circumoral, a little bit of duskiness. It's when they are really, really tachypnic, and then you see the central sort of cyanosis when they a little bit of energy, like with crying. That is that difference. What else would you do? listen to their chest, right? Listen to the breath sounds, but you can see it by that, just looking at them. How do you medically close a patent ductus arteriosus medically? There's surgically, which is just a clamp. They actually call it a clip, and they just close it off. But we can close it through medicine. Which one here is to close the PDA? And it's the indomethacin. Prostaglandin is the hormone mommy secretes to keep it open with fetal circulation, okay? Indomethacin is the medicine. It's actually an NSAID, and it closes it. How do you know it's closing? The murmur is going to go away. It's one of the big things. A child post-tonsillectomy is swallowing every 2 minutes. What is that? What should we do? Probably there's bleeding, right? And remember, all they've done is cut tonsils and adenoids out usually at the same time, and they've cauterized it, and it's a big scab. And if they're swallowing, there's bleeding going on back there. They need to go back to the OR most of the time and have it cauterized. So it is a dangerous thing. A child is walking on their tippy toes all the time. My daughter's friend child, when I first met her, was 2 years old, and she was walking on her tippy toes. She says to me, "What's going on with this child?" And I said, "Well, it needs to be evaluated, but it is some sort of autistic behavior." She was referred to the neurologist, and now she's in all sorts of intervention, speech, physical, occupational therapy, and she has improved. Doesn't walk on her tippy toes all the time, but that's all neurological. Something's happening there. A multi. What treatment should a child in pain with JIA have? What helps pain? So it's a little bit of everything. Now, they say warm baths work. Do not give me a warm bath that makes me feel horrible. Give me ice water baths, it decreases my pain. So it's a preference. Most like warm, not all everybody. NSAIDs are the perfect thing for pain. Unfortunately, I'm allergic to them. So Tylenol is what I get. And of course, distract them, let them play games, have somebody in there, watching a show with them, whatever it is. Those little things take their mind off the pain. And JIA is painful and it can hurt a lot. Highest priority for a child with sickle cell. Now you've already put the IV fluids on. That's always number one. Yes, it is. And I know somebody was thinking, wait, isn't that IV fluid bolus? Absolutely. But what about the fever? Yes, we can treat the pain, but most of the time, sickle cell attacks are usually due. They have a low grade fever. And it's the fever we need antibiotics to start. So you give IV fluids, you're going to give those antibiotics. Yes, the pain medicine is in the other hand, but your priority is to make sure that we address the fever and give the antibiotic so that we can fight that infection so it doesn't get worse. And infant sweat tastes salty. Facts. As I said, tell the parent to lick the skin, and it is extremely salty. And yes, we're going to check them for cystic fibrosis because that is one of the things, one of the signs that we'll see. The other thing is no stool for the first 24, 36 hours is the other thing that can tell you about cystic fibrosis. A child with bronchiolitis is being admitted. Remember, bronchiolitis is another name for RSV. Those names are used interchangeably. What's our concern with RSV, bronchiolitis? This child needs to be isolated again until we figure out why. We don't want it, transferred to another child. Very good. A multi. How do you diagnose hip dysplasia in an infant? So the positive ortolani, those asymmetrical folds, and of course that leg is shorter. Now, foot's pointing inward, outwards are actually fractured hips on the elderly. The hip dysplasia, the foot is fine. There's no inward, outward point on it. Why do sickle cell patients have enuresis? Think about it. How do we treat sickle cell patients? What is our biggest concern with it? Talk about going in airplanes and playing sports and being in the cold and the warm. We are telling and encouraging these patients to drink, 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 keep their vessels big and wide, right? So if they are drinking all day long, did they have an accident at night? Absolutely. And that's what that question was about. What causes acute glomerulonephritis? And again, that's just strep infection, so rheumatic fever and acute glomerulonephritis, both of them. Remember, they both can be returned back to normal if treated, and as soon as we get the treatment started, better for the child. Another multi. What may be a problem seen after surgery for tetralogy of Fallot? Again, tetralogy of Fallot, any congenital heart defect, having surgery. And it's a little bit of everything. These children, their hearts have been cut open, they've been manipulated, they've been stretched due to pressures and the blood. So they're going to fatigue easily. They're not going to be eating as well as they should. And of course, you worry about them breathing, also blood getting through and oxygen, etc. So, yes. A child with pertussis is receiving azithromycin IV. Priority to include in this child's plan of care is what? What do you worry about with pertussis and azithromycin? Well, when you're giving an antibiotic, you're worried about the abdominal pain, vomiting, diarrhea. Look for facial swelling or urticaria. Maybe you have an allergic reaction. It could be, but I think you're looking more of the side effects of GI upset with these children. But I'm not against monitoring the vital signs for, those anaphylactic type reactions. I'll have to change that question. An infant is scheduled for a cleft lip repair. Which information is priority to convey to the surgeon before surgery? Which one of these isn't right? Can you pick out a normal or abnormal lab value? I mean, it's any child going for any surgery. What do you worry about? And it's those red blood cells. It's too low and it needs to be looked at now before surgery. It needs to be found out why it's there before they even start cutting, because then, of course, any surgery was with bleeding. And a white cell count of 10,000, it's a high normal. It's not bad. When administering indomethacin to an infant who has a patent ductus arteriosus, anticipate which outcome. What are you expecting? Well, what does indomethacin do to a PDA? That's the medical closure, right? When you have a PDA, how would you know that? By looking at the child. You're going to have a washing machine murmur and a wide pulse pressure, right? So what are we going to see if this indomethacin is working? That murmur is going to go away and that pulse pressure is going to close up to normal. The parents of a boy who has Duchenne muscular dystrophy wants more children. What information should be provided? I'm just asking in a different way here. And it's all about that X-linked recessive, and figuring out, do they want to have another child and getting them to genetics. A multi. Which behavior by the child should alert the nurse to request a follow-up for possible autistic spectrum disorder? Again, it's that repetitive behavior and that indifference. History of temper tantrums, it could be. Because the child has the inability to express themselves. They don't know how to speak, they don't know how to say what they want. Stroking the hair, not necessarily. That wouldn't alert me. That's normal behavior for, a child who's cognitively just fine. Kawasaki disease management includes aspirin therapy. So, what's the benefit of that aspirin? Well, it's all about decreasing the inflammation, and it's all about thinning the blood, so preventing clots. So it's all of those things. A breastfeeding infant has low T4 and a high TSH. The best explanation for this is what? What do you know about thyroid hormones? So we know if the thyroxine is low, the TH is high. If the thyroxine level is high, the TSH is low. Always know it's always opposite. And that's about the thyroid, okay? And last question. After giving indomethacin to an infant and closing the PDA, what assessment would you see? I had a couple doubles and triples here, but I think you know the answers now. And again, your murmur's going away. And again, that 60 over 18 blood pressure is now 60 over 40. And that's the other sign of it. Hey, Amber. Good job, Amber. Chelsea. And Lady. Brittany did good. And so did Jules. Good job, guys. All right. So this is our last class together. From now on, I'm just going to quick meet you on week 12. Anybody who needs any extra time going over some HESI things, let me know. If not, I will see you on Saturday, 2 p.m. Eastern time, or please listen to the review. It is a very important review to help you get through this. So anybody have any questions about anything?
Professor Bogart, I have a question. Do you
Sure.
think they're going to put out, or when our HESI is actually next week? What day?
Okay, I do not have each campus when the HESI is.
Okay.
Those you're usually try to be around the time of your class. So that is from your campus. So, contact the campus. When is it being done? I don't have control on that.
Okay. Thank,
None, unfortunately.
thank you.
You're very welcome. Well, guys, that's all I have. It's been a pleasure. I will see you week 12.